But let's get back to the transgenderism, because guess what? It's still happening at Texas Children's Hospital. They actually announced that they would be stopping gender affirming care on minors. But here we see an investigative journalist named Christopher Rufo has obtained internal records indicating that this hospital secretly restarted its child sex change program 3 days later. So did they announce that they were restarting it? No, they did not. And here are some screenshots. The ones that I want you to see are these. And essentially, this is the physician. And then there's, in their internal systems, their database, they have right here, gender identity. Okay, here's a better. Medicine refill, gender identity. Testosterone levels, gender identity. This must be maybe a consultation and medication. But look at the ages, 15, 16, 13. You have a 17 and 18-year-old here, and then you have 14. So this goes to show you, and this was not the only doctor. This goes on to say, despite the hospital's statement that it had ceased these practices, Roberts has continued to manage a heavy caseload for gender-affirming care. So it's not just like one-off, right? Well, let's just sneak these 2 kids in. Just these 2 or 3. No. Multiple patient visits in a single day last week for gender dysphoria and gender identity, and another for HRT, which is hormone replacement therapy. So just that's a snippet of one day and one provider. How much money are these people making? I've heard a statistic that it's in the billions that this industry is making off of these kids and their gender dysphoria, which is totally evil. And like I've argued before, violates the Nuremberg Code. They should be put on trial just like those Nazi doctors were. 100%. Here's another physician, another Texas children's doctor, Harvard-trained surgeon, Christy Rylon, inserted and removed non-biodegradable drug delivery implants for gender dysphoria in pediatric patients throughout 2022 and 2023, including the puberty blocker Superlin on, get this, 11 to 15-year-old kids. And then there's screenshots here, which we don't need to see all of them. You get the idea. And then they had this personal testimony of a transgender child that they removed from their website with that whole message of, would you rather have a dead daughter or a living son, to justify to the parents who are rightfully concerned at times. They kind of guilt trip and manipulate your emotions to be able to get the parents to consent to these procedures. And of course, there's an inherent trust that we still give doctors because they are doctors, because they are educated, because they have supposedly taken the Hippocratic Oath. So we trust them. But what are they doing instead? Some of these doctors are manipulating these parents' emotions, terrifying them that their children may commit suicide, so just go along with it. Have your children get on hormone replacement therapy. It's okay for them to chop off their breasts and get phalloplasties and vaginoplasties. It's totally okay, because we're going to make some serious cash, and you totally won't lose your child to suicide, even though, honestly, as we will see, there's a lot of detransitioners that say otherwise.